Hello, this is a presentation on how to complete Portiuncula University Hospital's General Nursing Care Plan Documentation, Volume 4. On the cover page of the document, there's an area here to attach the patient's addressograph label. And we also have a signature bank. All staff documenting in this booklet must sign this page and include their printed name, signature, initial and NMBI PIN. On to page 2 of the document. This document must be commenced by nursing staff on the ward receiving the patient for admission. This same book can be continued if the patient is readmitted within 1 week, provided there is sufficient space for you to evidence patient reassessment and you are able to initiate a new care plan. Please complete the patient readmission sheet on page 39 of this book, and we'll go through that later on in the presentation. There are continuation booklets available on the ward also, so please insert a continuation booklet when the patient's length of stay exceeds this book. Each continuation booklet must be clearly identified with the patient name, hospital number and date of birth, the addition number, date commenced and a nurse's signature documented and secured in chronological order. All assessments are highlighted in blue. All care plans are highlighted in green. All interventions shaded in yellow must be activated, and care plans must be initialed and dated, not ticked. So you will see this as we go through the document. All entries must be, this includes all assessments, and this is our NMBI guidance, written in black pen, legible, dated and timed using the 24-hour clock, professionally signed with a clear signature, countersigned by a registered nurse or midwife if the entry has been made by a student nurse or midwife or healthcare assistant, in chronological order. Only approved abbreviations outlined in the HSE National Abbreviation Policy may be used. And that's from the Health Service Executive Code of Practice for Healthcare Records Management, abbreviations HSE 2010, with the exception of the National Early Warning Score abbreviated to NEWS and the Irish Maternity Early Warning Score abbreviated to IMUS, which are recognised in the Portiuncula University Hospital Documentation Guideline available on QPulse. The patient name and hospital number should be documented on each page of this book and on the continuation booklet. So here we have a nursing assessment index. So this is quite useful to help you navigate through the document until you become familiar with it. So the document is divided into the 12 ADLs, and within those ADLs there are assessment tools. So here we can see within maintaining a safe environment, that runs from page 6 to 9, and within that we have the falls risk assessment tool. It's the stratified tool which we use, and this needs to be completed within 24 hours of admission on patients over 65 or as required, and that's on page 7. The 4AT assessment for delirium and cognitive impairment, that's completed on all patients over 65 or as required. The risk balance tool for bed rails is completed as required. In our second ADL, communication and pain, we have the assessment, the pain ad for dementia and non-verbal pain. ADL 3 is breathing and circulation. ADL 4 is drinking and eating and drinking, or nutrition and hydration, and within that we have the malnutrition screening tool, the MST, and this needs to be completed on all patients within 24 hours of admission. We have the estimating height from ulnar length chart and the BMI chart. In number 5 is elimination, and within this we have the Michigan Incontinence Symptom Index, and that's completed as required, and the C-diff checklist is completed as required. Number 6 is the personal cleansing and skin integrity, and within this we have the in-depth oral assessment tool is completed as required, and the Waterlow assessment tool, which needs to be completed on all patients within 6 hours of admission and then weekly. The wound assessment chart is completed as required. Number 7 is controlling body temperature and infection control. Within that we have the VIP score, and we do that on all patients with intravenous access. Number 8 is mobilising. Safe moving and handling assessment form is within this, and that is completed on all patients on admission and weekly. Number 9 then is working and playing and recreation. Number 10 is expressing sexuality and body image. Number 11 is sleeping. Number 12, spiritual needs. And number 13 are additional blank care plans.